you so very much. My name is Christina Gibson-Davis. I am a professor here at the Sanford School of Public Policy at Duke University. And I am thrilled to have the opportunity to talk to you a little bit about our study and think about if there's how you all could help us with the completion of the study. So I have some slides. I assumed that they would be put up for me, or do I need to control them myself? You're muted, I'm sorry. I need to control them myself?
Yeah, can you share your slides?
I can, sorry, just give me 1 second. I thought that, I apologize. I thought that you were gonna be doing that. So let me just bring them up and then I will do that. Okay, now I need to share my screen. Just 1 second here. Okay. Right, can you all see that? Are you seeing
Yes.
Okay,
yes.
Fabulous. Okay, so I'm going to be talking to you today about the STEP study. STEP stands for the study of teen experiences that promote success. So just to give you a broad overview of what STEPS is. So STEPS is a longitudinal survey of adolescents and their parents on economic well-being and adolescent mental health. I'll talk in a minute more about why we're talking about these particular subjects, but just to sort of set the stage, we know that adolescent mental health is in something of a crisis right now, and we're not exactly sure what's going on. So one of the things we're trying to do is investigate that. Our goal is to collect information on about 700 parent-adolescent pairs, with an emphasis on getting more information from people who may be overlooked in more conventional surveys. And again, I'll say more about this, but one of the things that's really important to us as we go through with this project is that we hear from people who may not always be represented in other scale efforts. And then unfortunately, if they're not lending their voices, then we can't understand what's going on with them. So one of the emphasis of this project is hearing from folks who may be left out in other surveys. Our survey is taking place in 2 areas, right here in the triangle, and then we're working with some folks at the University of Pittsburgh. And we started collecting data about 2 years ago, and data is ongoing. So why are we trying to do this? Well, as I mentioned before, there's this unprecedented mental health crisis in youth. I don't know if any of you have teenagers, know teenagers, have talked to teenagers, but there's obviously something going on and it's not great. So we're seeing really high levels of depression, anxiety, kind of internalizing and externalizing behaviors that maybe aren't great. We know that economic factors contribute to this, but we're not exactly sure why. And the way we're thinking about this is we're thinking about the role of wealth. So I just want to take a moment and distinguish between wealth and income. So wealth is a household's assets minus your debts. So for most people, an asset would be like your house, or if you have any savings or a retirement account. Debts would be money you owe on your house, credit card debt, medical debt, education debt. So wealth is assets minus debts. So you can think about wealth as sort of like the store of stuff that you have, the store of economic goods that you have. And income, on the other hand, is money that comes into your house. So for most people, income is going to be like your paycheck, right? So it's a source of cash. So you can think about wealth as sort of a stock of resources, and income is sort of the flow of cash. When people usually look at how economic well-being relates to adolescent well-being, they usually think about wealth. Or I'm sorry, they usually think about income, but not wealth. But the disparities and inequities in wealth far exceed those in income. So there's a little graph that you can see that plots median levels of wealth and income for 3 groups: Black, Latinx, and white. And on the left-hand side, you can see that the racial and ethnic disparities in wealth are far greater than the racial and ethnic disparities in income. And we know from some other research that wealth really helps child and adolescent flourishing, that it's a really important resource. So these kinds of disparities in wealth are pretty troubling. So our overall goal is to look at understand how wealth and economic circumstances, including these racial and ethnic gaps, affect behavioral development in adolescence. I'm going to give you a sort of our theoretical model that guides sort of how we're thinking about this. So we think that wealth and economic standing has direct effects on adolescent well-being, but we also think that there's some things that can either help or can hurt how that association plays out. So one thing to think about is parental investments, so that we know that wealth affects people's money and time. So if you don't have a lot of savings, you may need to be working more jobs. Or if you have a lot of savings, you may be able to be spending more time with your kids. So those parental investments are really important and are likely dependent. And then we also know that the resources you put into your kids is going to affect your adolescents as well. Another important thing is familial stress. So every family has stress. The question is, how do you cope with that stress? How does that stress manifest itself? And we think that the level of wealth that you have can, again, inform various levels of stress. A third box is aspirations and expectations for the future. So this is both what do you want to have happen for either the parent or the adolescent, but also what do you think will happen. So we try and measure both what we think might happen and what we think will happen. And then finally, we think about social class and how that manifests itself. So what are the family's norms and cultural values, and how do these values affect parenting behavior? So one of the things we're trying to do with this survey is basically measure all of these boxes that you see on your screen to really understand the connections between wealth and adolescent well-being. So why are we doing this? Why can't we just, why are we spending our time collecting what we call original data? Well, one of the things that is true is that surveys that we might typically go to tend to focus on white households and exclude African American and particularly Latino populations. And obviously, if those voices aren't represented, then we don't have a diversity of viewpoints or experiences, and that just makes the data that we have that much more narrow and that much doesn't adequately capture people's experiences. The other thing is that when people collect data on wealth, they tend to do a really good job on collecting wealth data for people like me. So what do I mean by that? I mean, I live in a house, I own a house, I have a savings account, I have a retirement account. But these kinds of wealth modules may not do great for people who have lower levels of resources. So for example, in assets, we usually collect information on stocks and retirement plans. But there may be other kinds of assets that people have that may go overlooked, like small businesses or other kinds of entrepreneurial activity. In terms of debts, we usually ask about medical and education debt, but there are all other kinds of debts that may be important to families. So like debt from past due bills or payday loans. So when you put these two things together, the fact that we don't tend to ask enough questions of non-white individuals, and we may have some biases in how our wealth modules are constructed, we really are sort of left with a more limited perspective. And if we have a more limited perspective, then the data is limited into, and what we can do with that data then is limited. So what we've done in STEPS is we have a sample of respondents that are 1/3 Black, 1/3 Hispanic, 1/3 white, that are spread across education and income lines. So our goal from the beginning is to deliberately invite people who wish to participate, who come from a variety of backgrounds, to participate in our studies so that we can really understand what's going on in their lives. We've also tried to be intentional about collecting data on sources of assets and debts that may be relevant to them. And if we succeed, which I hope we will, then we're going to be a unique data source representing a diversity of peoples and perspectives. So the three goals of the studies are to examine how limited wealth, not just income, can affect healthy adolescent development. Our study also highlights the broader social implications of economic fragility on youth. When we started the study a couple years ago, the economic picture was slightly different than it is now. But I think events over the past 24 months have only heightened the need to really understand both the economic stresses and economic resiliencies that families experience and how then that translates into the well-being of their adolescents. And then finally, we also want to think about how these racial and ethnic wealth gaps shape opportunities for teens and their families as they move into adulthood. So one of the things that we hope we're doing by having this bigger set of assets and debts is not only thinking about deficits, but also thinking about assets. But by assets, I don't mean just financial assets, but ways that people are promoting their kids' well-being, perhaps using measures that haven't been collected before. So what does STEPS consist of? It's an online survey taken by both the parent and the teen. So one of the things that also makes STEPS unique is that we're trying to hear from the teenagers themselves, not just their parents. So we ask both sets of people questions. We sometimes ask them questions about each other and to sort of see, and then we'll see and compare. Speaking as the parent of a teenager, I'd be a little afraid what my teenager would say about me, but nevertheless, we think that's a valuable source of data. The survey takes about 20 to 30 minutes to complete. It's sent about every 4 months for 2 years. So we're going to have 7 survey waves in total. So one of the reason we are doing this is because we think that folks' economic circumstances can change over time. So we want to be really intentional about measuring any potential changes in their economic circumstances. So we have a really good understanding of how they are living in terms of financial well-being. And the survey is offered in both English and Spanish. And I should say, not only is it offered in both English and Spanish, but we spent a lot of time before the survey went live, making sure that the questions were culturally appropriate and made sense for the diverse group of folks that we were hoping to participate. Okay, so why would people participate? Well, we do offer financial compensation. Every time a parent and a teen fills out a survey, they get a $20 gift card over the course of the time that they participate. And if they fill out all the surveys, it's about $420 for the family. And just to reiterate, we give a gift card both to the parent and the teen because we think both of their participations are equally valuable. It's convenient. All the surveys are completed online, from home, or on your own schedule. So since they're online, there's no particular time scheduled appointment for the survey. And I'm going to talk a bit about this in the more. And it's a fairly easy to answer survey with full privacy guaranteed. And we don't collect any information on immigration or immigration status. Just want to highlight our confidentiality and respect for persons. So this is something that we take very, very seriously and want to make sure that people who are trusting us with their information know that we are trustworthy and that we respect what they're telling us. So we have Institutional Review Board approval by both Duke and the University of Pittsburgh. We also have what's called a certificate of confidentiality. This is something that the government issues, which basically means that except in very, very extreme circumstances, we cannot be compelled to reveal data that anyone has given to us. There are very, very rare exceptions to this. Basically, we can't reveal the information, even if somebody wants us to. It's also the case that all of our staff have undergone confidentiality training and undergone modules to understand the respect for persons. With the way we collect the data is that individual people are not identified in the data. So everyone is given an ID number, and that is what we use to look at the data. So I don't actually know who is provided what information. And also respondents can skip any question that they don't feel comfortable answering. So who's eligible for our study? The parent must identify as Black, Latino, or white. They have to have a child who's between the ages of 13 to 15. We're surveying one of 8 counties in the Raleigh-Durham metro area. So basically the 8 counties that sort of surround Durham. They have to be able to complete the survey in English or in Spanish, and they need to have access to a phone or a computer in order to complete the survey. So what are the engagement opportunities for you all? Well, we are hoping that you will share our study with your networks, newsletters, or community groups. This is obviously a very well plugged in group. So we would love to have, if you think this is something you could support, we would love for you to spread the word about our study. And we do think this is an opportunity to advance research on adolescent wealth, health, and opportunity. And again, just to reiterate a point I made earlier, it's really important to me that we be hearing from people who may not always be reflected in these surveys, because if we don't know what's going on with them, then we can't sort of think about how their experiences can inform our policies. And relatedly, the third thing is to champion Latino representation in research. And I guess this is just my point, and help ensure that Latino voices inform future policies. Oh, let's see. Okay, I just want to take a brief minute, and these are the members of our team. I believe you know Andres, but we have a wide variety of folks working on our project, some of which are on this call. Teresa's also on this call. I think Anna may be on this call, but we have a great team representing a variety of perspectives who are helping us to collect this data. We also have a number of community allies that we have engaged with, and so we have a picture of them or a picture of their icons up here. One of the things that was important to us is that our data not feel extractive to anyone. We wanted to really partner with folks rather than feeling like folks we were taking something from them. So we've really strived to create partnerships that make sense for both parties and to ensure people that there's value in participating in our study. Just also want to mention we have a project partner is the University of Pittsburgh, and that funding for this project came from the National Institutes of Health, from the Child Health and Human Development. So this is a government-funded study. I just want to quickly provide some overview of how we've recruited thus far. So you will see in the rows are the income categories that we use, and then the columns are the racial and ethnic groups. So we are recruiting folks who are low income, middle income, and high income. And then, as I said, they're either white, Black, or Hispanic. And I'm really pleased to say that out of our 283 families who are participating, 114 of them are Hispanic and 82 are Black. We're really just really thrilled that people have trusted us and are willing to fill out this study. However, we'd really love to have more Hispanic participation. I mentioned earlier we're partnering with the University of Pittsburgh, but they're actually not recruiting any Hispanic folks. All the Hispanic recruitment is being done in Durham. So the more folks that we can get from our site, the larger our sample size will be, and the more we'll be able to understand those experiences. Just to provide a little bit of preview of results, as I mentioned, one of the things that we're doing is we're collecting a wide variety of assets and debts. So this chart just shows you the kinds of assets and debt categories that we're asking about. So on the left in the blue are assets, and on the right in the green are debts. So for example, you can see that of the people we've talked to so far, 92% of them have a checking account, which is pretty usual. Just also want to say that as you go down the asset bar, you'll see some things like collections, business assets, cryptocurrency. Almost 6% of our sample has cryptocurrency. I don't quite understand what cryptocurrency is, but apparently 6% of our sample has it. And then if you want to look at our debts, again, the most common one is mortgage debt, which makes sense. But we also have, 18.6% of our families say they owe money for past due utilities. Nearly 17% say they owe money for buy now, pay later. So we're really seeing some sources of debts, and none of these sources of debts would be collected in larger scale surveys. So here's the contact information for us. We have a email address, which is just steps_Durham@duke.edu. We can also receive text messages. We have a website, and we have a QR code that you can sign. If you follow one of these things, you will then be contacted by someone who will sort of walk you through the next steps. There's a screening and a consenting process that we go through, but this is how you would get in contact with us. And I think that might be, yes, that is my last slide. So thank you.